Good evening. It's time to call to order the Oakland Community Health Network Board of Directors meeting. Before we rise for the Pledge of Allegiance, all of us, I think, were shocked by the events that happened on Saturday and the shootings that occurred in Rochester Hills. It touches all of us at the network because we work with people in Rochester Hills. I know the mayor has been a longtime friend of mine, Brian Barnett. But more importantly, we pray for the well-being of the victims, for their families, for the community, also for the first responders who probably saved other lives, because who knows what this man was going to do with all the weapons he had in his house. But be that as it may, before the Pledge of Allegiance, I'd ask please rise for a moment of silence for all those involved in the shootings and the victims in Rochester Hills. Thank you. And now the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God. Roll call, please.
Mr. Young.
Here.
Mr. Furman.
Present.
Dr. Giles.
Present.
Pastor Jones.
Present.
Ms. Woodruff.
Present.
Dr. Hans. She gave prior notice that she would not be able to attend. Ms. Newman.
Present.
Ms. Root. Here. Ms. May.
Here.
Mr. Torres. Mr. Landsman. He gave notice. And then, just for the record, Mr. Torres responded no as the
Yes.
RSVP. And Mr. Cowan.
Present.
You have a quorum.
Thank you. Next, we have a motion for approval of our board meeting agenda. The only additional item that was added from the COW meeting is our closed session after all of the items on the agenda. So that's it to you.
Support.
Motion and support. Do we need a roll call on the? No, you're correct. All those in favor say aye.
Aye.
All those opposed, the motion carries. At this time, we have an opportunity for public comment. The comments of the public are important to us. However, we do have a limit of 3 minutes for comments and would ask that that please be observed. And at this time, I'll ask if first we have anyone online who wishes to address the board.
Those online that wish to speak to public comment, please raise your hand at this time and also complete the form that's in the chat. I see Salim, you can go ahead.
Thank you. Good evening. My name is Salim Kareem. A vocational program called Freedom Works Opportunities is about to close down. And it's because OCHN is not providing them with a sustainable rate. They have been providing services to people with disabilities for the last 40 years, 4 decades. They will be the 5th vocational program to shut down in Oakland County in the last year and a half. OCHN has the funds to provide day programs with sustainable rates, but they are choosing not to. OCHN is allowing the support network for the most vulnerable people to collapse. The more day programs that shut down, the bigger the workload there is on group homes. Group homes are already understaffed to the point where they're struggling to get by, and this will become a disaster without the help of day programs. I'm a program supervisor at a day program called New Gateways, and I'm terrified of what will happen to the people I serve. Almost all of them need extensive assistance with either most or all activities of daily living. What will happen to them when New Gateways closes down due to OCHN's unsustainable rates? We know what will happen. Not only will they lose what helps give them healthier, happier, more fulfilling lives, but also their group homes will be too understaffed to adequately meet their basic needs. This is made even worse by the fact that there will no longer be day program staff to help find signs of abuse and neglect. Unless OCHN provides sustainable rates, it is undeniable that the support network for people with disabilities will collapse. The harm this will cause is nothing short of a disaster, one where the victims are the most vulnerable people in this county. The good news is that OCHN can provide the sustainable rates to stop this. It is only a choice between fulfilling your obligations to the people with disabilities or continuing to fail them. Thank you.
Thank you. Anyone else online?
Is there anyone else online? Please raise your hand at this time. Kathleen, go ahead. Kathleen, if you can unmute your mic, you can go ahead.
Hello, my name is Kate Kaufman. In society today, we need to have a voice to tell the caregivers that we need their help to serve as individuals that have unique abilities, like intellectual, developmental, and physical abilities. We cannot be ignored, and we need to expect everyone as equals to have a caregiver to help us to reach our goals so we can be independent, so we can live independently in our community, so that we can succeed in life to be successful in life as well. We have our rights to fight for what we believe and in what we can do to help caregivers to help when we need it the most.
Thank you very much for your comment. Anyone else online? Thank you. Is there anyone here in the audience who wishes to address the board? Yes. And I forgot to mention one thing. If you just state your name so we know who you are. Thank you.
My name is Susan Phillips. Can you hear me?
Yeah.
Been a direct care worker for over 14 years. I'd like to start off tonight by telling you a little bit about my experience in this field. I've been around people with special needs all of my life. My personal mentors had a special needs son. Some of my fondest memories as a child were with him. Cheering him on at the Special Olympics, coloring with him, and just doing some fun stuff. Never mind, I was a child at the time. I have a special needs niece that I will fight for no matter what. Individuals are why I do what I do today. My experience as of late working as a DSP in Oakland County has been of uncertainty. And seeing people I've worked with personally lose their critical services. This is not acceptable by any means. OCHN has a duty to make sure their provider network is stable and funded and that there are no service interruptions to individuals receiving services. Part of that stability is ensuring that DSPs such as myself are paid. Individuals served have staffing supports they need to live a quality life. When you affect our pay, it affects them. OCHN's decision to omit a previous $1 wage increase from January 2023 and then state that the 85-cent wage increase was passed along with an additional 15 cents does not remedy the situation. It has lowered the morale. It has lowered the morale and cause DSPs to leave this field as we feel underappreciated and unseen by you. There are surrounding counties that pay a higher wage to their DSPs, such as Detroit Wayne, and we are a richer county. OCHN needs to self-reflect on their decisions to treat their DSPs as they have done and start doing the right thing and fund DSP wages appropriately and competitively. I'm also aware that OCHN continues to underfund the service provider network and has plans to cut transportation reimbursement rates for over 40% of their providers in October. This will not only cause additional instability within the provider network, but will also interfere with services for persons served. How can OCHN say that services will remain status quo when your community is telling you this is not the case? You must do better for the people that you claim to support and advocate for. I urge you to step back and realize the recent decisions that have been made by OCHN's administration has and continues to cause network instability and create harmful effects to persons served.
Thank you. Is there anyone else? Yes, sir.
Just hit the button right. One more.
Oh,
There you go.
there we go. Oh, yeah, geez. In stereo. Yeah, my name is Zach Cardinell. I'm from Amork, and we recently held our town hall last week, and so I wanted to, first and foremost, thanks to Ms. Root, Dr. Hans, and Christine Burke for attending. It was hugely successful. As someone who attended Amork meetings as a young 18-year-old, with my mentors, people like Colleen Brayton, Jerry Provençal, and Lynn McGinnity, it was really refreshing to walk into a room and see 175 folks served, family members, DSPs, and advocates. But there was a little turn of events that happened I thought was really a good way to illustrate some of the frustrations I think providers and families are experiencing. When we first announced that the town hall was going to happen, OCHN reached right out, which was great, and offered to have presenting or a resource table. And I thought very politely to decline, no, we're very happy for OCHN to be a member of the community as anyone else, but we're not looking for presenters, not in that meeting. And also we didn't think the resource table was really appropriate for a town hall like that, but I did say if you can identify somebody, be happy to direct anyone that has inquiries directly to them. Christine showed up with a stack of documents, resources that, well, I'll touch on that in a second, I guess, but it was really heartbreaking because it seemed like she was under the impression that she was presenting. So there's communication kind of breakdown number one. I wasn't really sure, again, being completely transparent, not really sure what to do with the documents. I didn't have any time to review it, and it wasn't until Tuesday that when I was able to watch, thankfully, to the YouTube channel, I was able to watch the committee of the whole meeting that was happening during our setup of the town hall. And that's where it was presented to you all that at the, Suzanne apologized, for the late notice and the late presentation of the documents that were going to be presented at the town hall. This level of communication breakdown from the provider standpoint, we're seeing this a lot with the board, where we feel like things are presented, because I'm going to guess, and I'm making a huge assumption here, but I'm going to assume that more than one of you believed, based on the way that the documents or other things were presented to you about the town hall, that OCHN was going to have a larger role in the town hall outside of being a community member. And that's just a quick illustration of, I think, a larger issue that the providers and families experience with OCHN, with the transparency between the board and the communication breakdown. So I just wanted to share that. The other thing from the town hall, the number one criticism that I received was that we weren't harsh enough on OCHN. And again, for transparency's sake, in our planning meetings, every single one of our planning meetings with our presenters and the Amork Planning Committee, we continue to talk about how important the collaboration is. We never wanted the town hall to become a let's kick OCHN. We really wanted to motivate people and get people engaged again. And what was really exciting for me was seeing 175 people leave that meeting and blow up my inbox with how much they are motivated and interested in getting engaged again in advocacy. What we were able to do, we've gotten quite a bit of attention from media outlets and representatives. We were able to do that with a $300 room rental fee and a $20 subscription to MailChimp. I'm here tonight to just ask, capitalize on this energy. You can white knight this if you wanted. Keep the provider network whole so that we can continue providing supports and continue to advocate. We know that the financial situation at the state is moot at this point, right? It's voted on by the end of the month. That's nothing we can change. But we have momentum to collaborate with OCHN, provider networks, families, folks served. Kate making public comment. She arrived at our meeting and made public comment at the town hall. People are ready. So I'm asking you, capitalize on this moment, please. Thank you.
Thank you. Is there anyone else who wishes to address the board? There being no one, we'll thank those who did comment, and we will close public comment and move on to stories that inspire hope. And Suzanne, I think, has a guest she introduced to us.
Good evening, everyone. It is my pleasure to introduce Kate Spinney. She is the Director of Health and Human Services at Affirmation, and with June being Pride Month, we thought it would be appropriate for our partners at Affirmation to talk to you a little bit about their programs and some of the impact that they have on the individuals that they serve and the outreach that they do in the community. And Kate has a lot of information to share with you today, so I'm going to turn it over to her really quickly so that she can get as much information to you as possible, and you have some time for questions as well. So I'm going to introduce Kate.
Hi, my name is Kate Spinney. I am the Director of Health and Human Services at Affirmations Community Center. And my background is as an MSW. I like to think that I was basically raised by the CMH system because that's where I started out my career. And so I know CMH very well, most of the PHPs and some of the faces in this room. So it's very exciting to be here. I am going to give quite a bit of information and try to talk directly into the mic as much as possible because I'm a mover and a talker, so I apologize. Just some background on Affirmations. If you're not familiar with our organization, we have been around since 1988, and we're kind of born out of the gay liberation movement. We are a community center. We're located on 9 Mile in Ferndale, right off of 9 Mile in Woodward. We have provided a vital resource to the community of LGBTQ plus individuals over the past 35 plus years and offer services such as support groups, social events, youth programming, behavioral health care, that includes therapy and case management, and do a lot of community advocacy. I know that the purpose of this time today is to discuss stories that inspire hope, but I wanted to also provide some context about the queer community and some of the issues that are outstanding within the queer community. Suicide rates, substance use rates, homelessness, the risks are incredibly high for the community, both in youth and adult populations. we see that queer young people are 4 times more likely to attempt suicide during their adolescence than their peers. We see that LGBTQIA youth and young adults are 120% higher in risk for being unhoused or homeless, mostly as a result of family rejection and being displaced. We also see that the overall substance use rates, you're nearly twice as likely to have some type of addiction than the heterosexual community. And if you are identifying as trans or non-binary, it's 4 times more likely to have substance use and other addictions. So the reason I wanted to point that out is because without understanding the place that we're coming from, it's hard to inspire hope. And it's important to provide that context as you're looking at success stories. So, slide. Thank you. So some of the protective factors within the community are, an accepting adult that that is in the young person's life. There's significantly lower rates of suicide attempts if you have at least one. That's just one, doesn't have to be a parent or guardian, it's just one accepting adult in your life. Having LGBTQIA competent mental health care, or having somebody that's affirming and accepting. And that's, I think, one of the biggest resiliency factors too, is when you're connecting with mental health, with substance use, having the opportunity to know that you can be exactly who you are when you go seeking that kind of support. Building relationships with other adults and peers, so social supports, and having non-LGBTQ allies also increases resiliency and positive school climates, especially as we're looking at the rates of violence within the school communities. It's incredibly important for queer youth to feel like they can trust their counselors, they can trust their teachers and the school administration to be supportive. The other big thing I want to point out is pronouns. I know that sometimes it can get confusing. Sometimes there's a lot of choices, but at the end of the day, respecting and honoring someone's preferred name, their chosen name, and their identity decreases risk factors exponentially. And Affirmations has been delivering services to the queer community for this many years, over 35 years. We've just, within the last 5 years, added behavioral health care, knowing that there is such a gap within our system for affirming and, LGBTQ informed services. There's a significant lack of access to affirming resources on whole. And some of the really exciting things that we've heard recently from individuals that we serve are that I wrote some quotes down because I wanted to share them. I've never felt safer in my life until I first walked through those doors, meaning Affirmations front door. I have finally found a community. When we first came here, I thought I was going to lose my child to suicide. I have my child back again. And I think the biggest piece that we need to consider as a system is how do we continue to support LGBTQ individuals in a meaningful way. Next slide. So with that, we have a lot of youth programming, which we're trying to continue to wrap our arms around the youth in our tri-county area. I know that we're conveniently located in Oakland County, but we do our best to push out into neighboring counties to be able to provide as much support and affirming services as possible. We do youth leadership and job readiness. We do a drop-in on Friday nights from 5 until 10 p.m. so that any youth that is interested in collaborating and spending time with their peers can do so in a safe, sober, and supportive environment. We have arts and culture, other more technologically advanced services than I am familiar with, but we have a Discord server and some other things that we do. And some of the feedback we've gotten from the youth programming is that there is no other place that they can go and truly feel like their authentic selves. And that's a really great feeling to be able to provide that space. We also have older adult programming. MyGen, which is formerly SAGE, if you're familiar with SAGE, is co-located in our facility or in our center. They do senior speaker series, they do book clubs and other social activities like arts and yoga and other things to be able to provide those services, and then, additionally training and education. Support and discussion groups. So you can see the list here, it's pretty extensive, and we're always looking for community feedback and ideas as to how we can diversify our programming and better meet the needs of the community. But in total, we have about 29 support and discussion groups. We have 10 recovery-based groups, and we, in the last year, had served over 6,000 people. So we also provide healthcare clinics on a rotating basis where we do vaccines and Mpox vaccines, testing, and sexual health and education. So our mental health therapy is where I got most of my quotes, and a lot of the really amazing progress that we've seen in our individuals served. And, we provide individual, couples, child and family therapy. We are working on building out and trying to expand our network of service, mostly because peer-delivered services are incredibly powerful. And I think that OCHN, for one, really shows that they prioritize peer-delivered services and the value in peer-delivered services. I think with affirmations, we take it that step further and say, okay, how do we deliver behavioral health care within a queer agency, and being able to support that behavioral health care from that perspective. We also do group therapy and have lots of plans on expanding those service offerings to be able to support the community and build community within. Care management, because of all of the risk factors we talked about earlier, there is a desperate need for case management within LGBTQ spaces, unhoused, not connected to public resources or state resources, transportation, et cetera. So we do provide food resources. We do a Let Us Help food pantry one Saturday a month, and are able to connect with gleaners and some of these other food resources to then pivot and ensure that there's access or equitable access to the queer community. So we do transportation through Uber rides, and we also have legal clinics and other kind of clinics that are specific to the needs of the LGBTQ community. Community events, all kinds of events. Next slide. I'm trying to be cognizant of time because I know you have a lot to get through on your agenda. Essentially, the call to action throughout all of this is how can we increase access, especially during June when we're thinking about Pride and everyone's going out, those who are allies and a part of the community fly the rainbow flag and go participate in Pride events. And then what happens after June is over? What do we continue to do for the community to support and sustain and improve the community and the individuals within it? So my call to action for everyone, especially within the CMH and PIHP systems, are to increase education and awareness of the providers, to increase the number of LGBTQ competent or identifying individuals, especially trans-affirming behavioral health providers. Have additional family support and evidence-based interventions for family, friends, and allies. Strengthen and partner with LGBTQ behavioral health care providers and community centers to increase that social support and access to resources. I can't stress enough how unsafe a lot of our resources currently are. Knowing that you're walking in as a trans individual, how safe are you going to be in a residential, setting? How safe are you going to be taking public transportation? What are those risk factors, and how do they contribute to mental health issues, anxiety, PTSD, those types of presenting diagnoses? LGBTQ teams and specialists within the CMH network would be incredibly helpful, especially if we're thinking about services like ACT or home-based, the types of care that are more intensive for good reason, and then expanding peer-delivered services. I added resources in here just in case anyone was wanting some light reading in the evenings before they go to bed to support additional learning, and if you have questions, you can feel free to check out the resources that are in here. The PowerPoint itself has the links, and so they should be live. But I'm also more than happy to coordinate or to chat with anybody who may have questions. I know sometimes that the unknown can be, you don't necessarily want to ask questions that you think you're supposed to have the answer to, but that's not the case in this situation. It's important that we're all informed and we make every effort to learn about the people that we're serving. So my information was on the first slide, and I brought a lot of handouts for people if you're interested in the services that Affirmations can provide. And at the end of the day, I like to think that we're making a huge difference in the community. Thank you for having me.
Kate, thank you very much for coming this evening. We appreciate the work that you're doing, your organization is doing. It's a very welcoming organization, and I can understand the comments that you've gotten from people who visit and utilize your services. So we thank you. Does anyone on the board have any questions for Kate? Yes, Christina?
Hi. I'm just wondering, for your mental health services, do you have a medication provider on staff or partnerships with someone that's affirming in the area?
We have referral sources, but we don't currently.
Okay.
I would very much love to provide that resource. So if you know of anyone, that would be a good referral source or somebody that we can collaborate with. Okay. That would be phenomenal.
Nice.
At the end of the day, we always are committed to ensuring that whoever we collaborate with and whoever we recommend is someone that will be affirming and informed and educated on the queer community. And there is a very significant shortage of those within the medical community. Mm-hmm. And I would love to collaborate with someone.
Okay.
Thank you.
Dennis, I do have a question.
Go ahead.
Okay. Is transportation still a barrier? Because I know when I was working with youth that were living in homes that were not affirming, they could not get their parents to transport them from northern Oakland County down to Ferndale. Is that still a barrier for them?
For youth, it can be. We have our Uber program and provide transportation, but as we know, we can't necessarily do that with young people. or without oversight and guardianship. And so that does tend to be an issue, and we're working on finding resources to rectify that. Finding grants to support a driver, for example, can be challenging. But thank you for raising that issue. It is still a concern.
Thank you.
Anyone else? Well, Kate, thank you again for coming. The information is important, not just us, but to people who could utilize the services, and we hope we've helped you get the word out during Pride Month. Thank you very much.
Thank you.
At this time, we'll move on to the regular part of our agenda. First, the board chair executive report. Certainly, we've had issues, as we do every month, that I deal with respect to finances, so that has been at the forefront. I did mention, and just briefly want to mention it again, I mentioned it at the COW meeting, I was able to participate with a wonderful group, Team Guts, the Friday before Memorial Day weekend. That's a group that provides athletic and martial arts opportunities to the community that we serve, and they're out of Clawson. They do a wonderful job with people of all types of challenges, both adults and children. They were invited to bring members down to Masonic Temple to participate in about a 90-minute event with the XFC fighters. Many of you have heard UFC, because that's the one that's televised. And they were having an event that night. And I've been to a lot of these types of events. The fighters and the team at Masonic and XFC just could not have been more wonderful. And everybody left with smiles. They had a great time. They got to fight with some of the fighters, but more importantly, they learned some skills. It blended right in with what Team Guts does with its martial arts program. So I was very pleased, and I mention that only because we've had, since COVID, a decrease in the amount of what I would call social, athletic type events for people in our community. And I give a clarion call every chance I get for, we had a lot of groups, there were churches, nonprofits that did events, and they've kind of paused that, and we'd ask them to revive it, to join Team Guts and others who are doing things that give an outlet to those who are in our community that have an opportunity for social and other events, athletic events, outside of the normal course of their day, whether they live with their family, with the group home, or otherwise. So I just wanted to mention that. Next, we have the Policy Management Committee Chair Report. Christina?
Last week we had one item on our agenda, and it was a presentation by Adam Hamilton on the Zero Suicide Initiatives and Program. And that's all.
Thank you. And finally, our Finance Committee Vice Chair report this evening. So pinch hitting for Mr. Landsman is John Young.
Thank you. We've got some contracts coming up, so I'll just hit two quick things. Financials were presented by Interim CFO Patrick Franklin. They're for the fiscal year through April 30th. The recertification process is definitely having effect on the decrease of persons eligible to receive Medicaid. Theoretically, it should end in May, but we'll see if that extends through June. On a good news front, the state has begun adding an additional $2 million per month for the remainder of the fiscal year, $1 million for current month and $1 million per month retroactive. So it sounds like good news, but the year-to-date financials show OCHN net position down $2.775 million. We were supposed to be up $1.5 million. So a tight situation, to say the least. Contracts will come up. The other thing was Kalana Ali, our in-house counsel, presented a PIHP contract amendment, which we voted on given we had a quorum of board members. That's it.
Thank you very much. At this time now, we'll move to our board approval items, and the first is the LJ Rolls contract, which is an extension of the HVAC services for this building.
So for LJ Rolls, you'll notice when you come in the building, the doors don't push open. That was the dampers getting fixed. This is a one-year extension for a proposed amount of $150,000, starting July 1st, running through the fiscal year through next June 30th. It is an extension, not a new contract.
Making a motion?
I'll move for approval.
Support. Is there any discussion? This item was presented and discussed at the committee of the whole meeting last week. There being no discussion, could we please have a roll call vote?
Mm-hmm. Miss May?
Yes.
Miss Root?
Yes.
Miss Newman?
Yes.
Miss Woodruff? Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next is the printing services contract with Allegra Print and Imaging. This is a 3-year contract. Mr. Young, you want to?
A 3-year contract, proposed total amount is $320,040. Allegra provides all our printing services as well as some mail services with their letters, brochures, flyers, newsletters, handbooks, training manuals, postcards. They also assist with the large mailings. Suzanne presented last week to the Committee of the Whole. They are a long-time vendor, but this is a new contract for them. So I would move for approval.
A motion for approval?
So moved.
Support? Is there any discussion? We also discussed, and this matter was presented last week at the Committee of the Whole meeting and recommended for approval. Roll call vote, please.
Mm-hmm. Miss May?
Yes.
Miss Root?
Yes.
Miss Newman?
Yes.
Miss Woodruff?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you. Next, we have a resolution. Christine, could you give us a little overview on this resolution? We did get some information forwarded to the board, but not in time to go over last month. So, our Committee of the Whole meeting last week. Thank you.
Yeah, I apologize for the last-minute submission with Mr. Cornell. So we are approaching the end of the budget. There are a lot of advocacy opportunities that are being presented to us rapidly. One of the things I just wanted to, kind of how this ties into our overall advocacy efforts, and we talked to the board a lot about how we advocate to the department for additional funding. I am one who, until that budget is signed the last day, we will continue to have respectful conversations with our funders and our legislators so that we are being mindful of our ongoing relationships with everyone, and at the same time being bold to talk about the needs of services for the people we serve. So one conversation, I know you're aware of the original $116 million that was dispersed. We continue to try and identify and propose some options for increase in costs, which would lead to the disbursement of the remaining, what we think is $94 million. I have heard from Alan Bolter that it is higher, but our hope is for those funds to be dispersed throughout the state. Some other ways that we're advocating, we have a bill monitoring track system so that our subject matter experts can review what bills are coming up that are related to our network. Then we work with our legislative consultant who will put in a card and say support or oppose or neutral, because there's, in every decision, there's a ripple effect with our network and ultimately services for people. The ISF, which I know we have talked about, it's the Internal Service Fund. We sometimes collaborate with all the other PIHPs. We sometimes advocate separately, independently, depending on the needs of our county. In this respect, the resolution was presented to us by another PIHP. I think several of the PIHPs modified it because there is language being presented by the Michigan Department of Health and Human Services that modifies the manner in which we can save funding in our save funds in our savings account. Two examples of the significance of those dollars: when rebasing was implemented, we relied heavily on those funds to continue to promote services when other communities were having to end them. The pandemic is another situation. Before the ARPA dollars funds became available, we did have to fund some things up front. So the conversation that we're asking, that the PHPs are asking us, CMHA is joining us in that the language puts us at a greater risk. It requires the PHPs may have to return some funding, and it really just changes the system entirely in how we manage and ensure that the funds are available to provide services. I hope that wasn't too much, but it all ties together.
Yes, thank you. Does anyone have any questions for Christine? There being none, does the board wish to adopt this resolution and send it on consistent with what was described by Christine?
I'll move for adoption.
Support.
A motion and support. Do we have any discussion? There being none, roll call vote, please.
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Ms. May?
Yes.
Mr. Cowan?
Yes.
Motion carries.
Thank you, and please keep us posted on whether we and the other networks have any impact on making this critical change.
Yeah, and I just want to express my gratitude on behalf of our leadership team and staff to this board. I know you stand behind us when we are having these really important conversations, and it does make a big difference.
Thank you. Next on our approval portion is a Recipients' Rights Committee recommendation. Vicki?
Good evening, Vicki Suter, Director of Rights and Advocacy. We find ourselves with a vacancy on our Appeals Committee. By policy and by Mental Health Code, 3 members of our RAC Committee are supposed to be on the Appeals Committee. When one of our Appeals Committee members who was also on the RAC termed out, that created a vacancy. And so at our May meeting, the RAC members asked who would be interested and recommended that Renee Nettle be appointed to our Appeals Committee. So we're asking the board to approve her appointment to the Appeals Committee. Currently, the board members that are on that Appeals Committee are Mr. Furman and Mr. Landsman.
Thank you very much. We have a recommendation for Renee Netto to be on the Appeals Committee.
So moved.
Motion?
Support.
Support? Thank you. Is there any discussion? I think we recently appointed Renee to the...
Yeah, she's relatively new, but
Right.
she's
Well, if she wants to take on more
she's
work,
very interested.
We love her. So, yeah. So tell her we appreciate her work for the committee and on the Appeals Committee. Roll call vote, please.
Sure. Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Ms. Root?
Yes.
Ms. May? Mr. Cowan?
Yes.
Motion carries.
Thank you, Vicki. Okay. Next is our consent agenda. These are minutes of both the board and various committees. Do I have a motion for their approval?
Move for approval.
And a support? Moved and supported. Consent agenda items are not discussed, so we'll move right to a roll call vote.
Ms. May? Yes. Ms. Root?
Yes.
Ms. Newman?
Yes.
Ms. Woodruff?
Yes.
Pastor Jones? stepped out for a second.
Getting coffee. Pastor Jones.
There
you go.
Dr. Giles,
Yes.
Mr. Furman,
Yes.
Mr. Young,
Yes.
Mr. Cowan,
Yes.
motion carries.
Okay. Under the other business item, number 6, I do not have any item. Does anyone else have any other business to bring before the board? Or on the board? Yes.
Dana Lassenby. I just would like to update this board on the hiring of our new COO, Ms. Tricia Zimbo, and she accepted the position and she hit the ground running. So I just ask you to join me in congratulating her and thanking her for taking on this new role.
Trish, on behalf of the board, I think I can safely speak. We wish you all well. We thank you for stepping forward. You've been a person who's demonstrated meeting every challenge they've been given, so we're going to have to ask you to keep it up. So thank you very much, and congratulations. Yeah, thank you for letting us know that. Next, we have board reports of 3 committees. Dr. Hans is not here this evening, so do we have recipient rights? Is there anybody pinch hitting? Otherwise, we'll hold that off till our next meeting. And then Citizens Advisory Committee, Christina Root.
Thank you. So the June CAC meeting was held last Wednesday online. We received 2 main presentations about the New Horizons Customized Employment Services and the AOT program that is in partnership with Wayne State University. And AOT stands for Assisted Outpatient Treatment. An OCHN Behavioral Health and Justice Liaison was the one who gave that presentation, and she did a really good job explaining this pretty complex program. And I think it would be nice if we could receive that presentation as a full board, unless if we have recently, and I just don't recall. No, sorry. Okay, thank you. Yeah, I think that'd be really beneficial for us, maybe in a study session, but I'll follow up maybe with Sheila and other staff to see if we can get that planned at some point. And that's it. That's my report. Thank you.
Thank you, Christina. And then the Oversight Policy Board Committee meeting, Sarah May.
Thank you. The Oversight Policy met on May 22nd at 1 p.m. in person here. We had a presentation from Catholic Charities La Casa Amiga by Jasmine, I apologize if I pronounce her name wrong, Beltran. They provide services for people who are at risk and are also English as a second language. So they meet with 500 people, more than 1,600 direct contact hours. They provide DUI prevention, mentoring, tutoring, summer camps, volunteer training, and parent school liaisons, which I think is pretty important. We had a vote that I'm really excited about to use some PA2 funding to fund a research, hold on, I'm trying to find it. Okay, IRB research project for OPVI, which is like Narcan, except it lasts longer. The biggest issue with Narcan is that it takes quick effect, but it doesn't last long, so people are still in the overdose when the Narcan wears off. And so they could then pass, especially if, say, somebody got the Narcan out of one of our Save a Life boxes and they were caring for a person that was ODing and there wasn't emergency services there yet. They could overdose and pass before emergency services could get to them. Also, I think it's really important. My husband's a firefighter. I think it's super important to study a longer acting medication, because a lot of times when people wake up from Narcan treatment, they are aggressive and violent, and they could injure healthcare workers or first responders. So we're working on, it's an FDA-approved nasal medication, and we're partnering with the Alliance, which is our distributor for the Save a Life boxes. And we want to do a research study with Wayne State, I believe, to study Narcan, Obvi, and the side effects, et cetera. And it'll be a 2-year project costing $275,000, and that passed. So we're going to start working on that, which is really cool. And then that was about it. We had the legislative updates and some vaping initiative. We had to set aside the vaping initiative updates because the meeting ran really long. And that's it. Thank you.
Thank you, Sarah. That is the end of our the business portion of our meeting. At this time, we have a second opportunity for public comment. Is there anyone online?
If you are online and wish to speak to public comment, please raise your hand at this time.
No one? Thank you. Anyone in the audience who wishes to address the board? There being no one, we'll close public comment, and next we'll move to our director's report. Dana?
Good evening again. Dana Lassamy, CEO. Again, we find ourselves tragically addressing active gun violence in Rochester Hills. And at this time, I wanted to invite Trish up again to give a quick update on our involvement. And I really have to commend, it's sad enough that we have to do this again, but I really want to commend our team because they were boots on the ground again very early Sunday morning. We found out about the incident Saturday afternoon, and quickly we communicated with one another, and Trish has already shown why she's best for this role, but got the team together, and our CISM team, which is Critical Incident Stress Management Team, we're certified and trained. How many? We have about 20-something?
We're approximately 25.
25 staff who are trained to provide that service and support. So Trish has been boots on the ground every single day, as well as Adam Hamilton and a number of different staff members who just jumped right in place to support. So I want to commend them for their hard work and just dedication to serving this community at this very difficult time. So,
all right. So unfortunately, we are in the situation of responding to another mass shooting in our county. We have been training since Oxford for when this may possibly happen again. So as Dana mentioned, we have approximately 25 staff trained in CISM. We've been partnering with our law enforcement, training with them, and also building up our partnership with the Oakland County Emergency Management. So I got the call from Emergency Management on Saturday and was able to get back in town to deploy our team. We had about 12 of us that responded on Sunday and set up the Family Assistance Center with Emergency Management. And we were there from 10 to 4. And then we also attended the vigil at Woodside Bible Church, where we were able to provide some handouts that we have for our critical incident stress management team. We are set up every night this week from 4 to 8 p.m. at the Department of Public Safety in Rochester, which is open not just to people who are at the splash pad, but for anybody in the community and even anybody in the surrounding areas that were impacted. So we've been keeping tally. We've approximately, from the last text I just got, have communicated with approximately 26 individuals. Some of those were victims, some of those were family members, some of those were individuals who were there, as well as community members. We've been debriefing with the county every morning at 9 a.m. So emergency management, OCHN, the county exec, the health division, the sheriff's department, the city of Rochester Hills, and other partners. We're going to be meeting tomorrow morning with what we consider a partners meeting that will be ongoing with our elected officials, commissioners, state reps, Dana and myself, and other partners as we continue to look at this long term. We're planning to be in the community for the next few weeks at different events, also probably moving locations from Department of Public Safety, which we can only be in the evening, to hopefully a school once they confirm a location for that. So we will be in the community for the next few weeks. We've also, with emergency management, connected with Lathrop Village, who also had a mass shooting in their community, and so being able to provide that CISM service. We've reached out to our providers, as well as our partners in Macomb and DWIN, who also have CISM trained staff, so that we can pull on resources so that we make sure we're not overextending our staff. We do daily debriefs with our staff. And again, all things that we learned in our response to Oxford of what we could do better when this happened again. So daily debriefs with our staff, debriefing with each other, making sure that we're okay, as well as connecting with our partners. I've been so impressed with our staff and the way that they show up, and even the partnerships that we've created and how strong they are. Really impressed with this community and what we have to do when we're called upon. So I probably forgot something, but I'm not sure what.
Well, there's been a lot going on since Saturday, so if you
Absolutely.
forgot something, you're forgiven.
Thank you.
I was on the other side of the state when I heard about this, and I did stay up. I was able to connect to see the press conference late Saturday night, and the one positive was that now early on the police officials and first responders and communities tell people that there's help available, and they specifically mention it, and I think that's important. They got a million other things on their mind, but it sounds like because of the relationships that they built with us and we built with them and the providers, that now it's all top of mind. And we know that the hospitals are going to take care of those who are wounded, but we have other people who were wounded and they need assistance also. So I thank you for the extra special effort you made over the weekend to get everybody together, and thank you to the entire team. And I know they're going to be there for the community for as long as they need assistance and beyond.
Absolutely. Our staff of 25 who've been trained they all volunteer for this. So this is above and beyond their regular 40-hour job. They've gone through a minimum of 40 hours of training. We meet monthly. We practice monthly. We've gone out on multiple situations where we've responded to critical incidences. And we've been, giving both group interventions and individual interventions. The team is made up of both clinical and non-clinical staff, and we've been practicing in hopes that we don't need it, but unfortunately we have. I don't even know if I'm supposed to call him.
Go ahead.
That works. Since you guys are on the ground there, is there call to action or anything that the general public can do to help the community? I'm sure there's GoFundMes that we can donate to for those who need medical care, but do you know if there's anything that just anybody could help with?
Absolutely. So we've set up a website regarding mental health services, and we've been pushing out all of our materials, 988, how to get in touch with services. The county also has a website set up where they are linking to Rochester's site and to the sheriff's and to ours. Unfortunately, we've had a lot of illegitimate, GoFundMe set up for individuals posing to be victims, and so our sheriff's department is verifying all of those. So all of the verified sites that are legitimate will be linked on the Oakland Cares website, which is, we're also linked from our website, but it will be on the county website as well.
It's also on Rochester Hills
Yeah.
City. That's,
Yeah.
Okay.
if people aren't sure or are uncomfortable going to the sheriff's website, no offense to the sheriff, we had a meeting obviously we were 2 miles away on the other side of this, and we had a concert going at Meadowbrook Outdoor Theater, so we were on alert from about 5:14. So that's probably the best bet for people to go, the Rochester Hills one, because you're right, somebody set up, faked the name of the family, one of the families that was shot. So that's probably the best bet. I'll compliment Adam. I saw him on the news. He did a really good job in a really rough situation, to say the least. And Mayor Barnett, there was a conference call for, obviously, all the organizations in the area, and Brian said to send his thanks to you all for stepping up so fast, because it's something truly nobody ever expected to happen.
Yeah. I will give a big shout out to Adam Hamilton, our Director of Clinical. He leads the CISM team with me, and he is, my partner in all of that. He's been doing all of our clinical interviews along with Dr. Posios as well. And shout out to our communications team for setting us up with, talking points, but also getting materials out. Things we learned from Oxford is we're getting materials out to urgent cares. We'll be delivering them to churches. I think they even added in cooling centers for this week as well, looking at direct mailers for the surrounding community, making sure that the fire stations and the city hall and the parks department have all of our materials to distribute to the community. So, I would say every department here is assisting and helping out.
Good. Yvette?
Is there coordination with Macomb County, since the shooter lived in Macomb, and a lot of the neighbors are feeling, mental health issues as it related to living in that community with that person? So is there coordination for those that are living on that border?
Yes, Dana's been in contact with Tracy, who's the interim CEO over there, on how we can coordinate and partner. And I mentioned the direct mailer that we'll do. That's usually a radius, so that will cover, since it's only within about a mile of where the incident is.
Thank you.
All right.
Again, thank you to you and everybody on the team. We appreciate all their efforts and extra special efforts on a weekend and coming in and making sure that those we serve are taken care of.
Absolutely. Thank you.
Thank you. And, I have to emphasize the reason this works is because there's a collaboration between the community, law enforcement, and just all of our stakeholders. And the other thing I'll say is that we have been in contact with Detroit Wayne as well as Macomb, and other surrounding areas have offered their support as well. Some of them also have CISM trained and certified people to help and support. And so I have to give, again, lots of thank yous and support to Adam and Trish, because they also identified the need in other areas that are experiencing violence, or where we've also seen gun violence at, I hate to say it, large levels or large amounts, and very traumatic, in a neighborhood in Southfield or Layfield Village, where we saw 6 individuals killed as well. And so the other things that we're doing in terms of notifying the state and also reaching out to the state for any support that we have, sadly, when we asked for about what we can do, we were told by federal authorities that there's often no funding when there are no fatalities. So sadly, that means that we have to advocate to other like to the state and other potential supporters, so we can get additional funding, because 1, we need to have more people trained and able to support, but 2, we also have to have the supports that these families and these victims will need in their recovery. So not only the immediate, but long-term supports that they'll need to somehow try to recover from this event, which, it sounds impossible, but I think with those early interventions and supports, we can see how we're helping families in the community to heal, and that we're there for them ongoing. So that's really critical. I'll go really quickly through the rest of my report. I do want to thank our Stories That Inspire Hope. It's right on time in recognition of Pride Month. Also, tomorrow is Juneteenth, and it's a national holiday in which all of our teams have off tomorrow, but we will be working. We will be working and continuing to support Rochester Hills as long as we need to. The other thing I wanted to highlight, I did highlight the big news about Trish, but also in terms of collaborating. I know there's a lot of conversation with our providers and working with them during these trying times. So I want to make sure that this board is aware. We've been meeting with our providers. We had a meeting this afternoon talking about the challenges as it relates to our funding. And really the critical piece is standardizing. We want to standardize some things so that we can be more efficient and cut some of our administrative costs and make sure that more of our dollars are going to services. We also talked about working together and advocating to the state because, as you know, from the proposal, the resolution, I should say, that we presented for the ISF, that also relates to our funding challenges as it relates to the redetermination, the end of the public health emergency, also the end of other funds that were available during the last 3 years that are no longer available. So as you may know, there is funding that was released by the state. That was that $2 million we're getting every month to cover future months and the current month. But there's also a remaining amount of dollars that are there that have not been distributed. So we're asking for our provider community as well as this board and other stakeholders to join us as we go to the state and advocate for those funds so that we can, again, put out those dollars to ensure that there's no stop or interference or delay in service delivery. So we know that our providers are struggling, but we also know that we're working diligently with the state to see if we can get those dollars released so we can pass them along to this community. The other thing that we know are challenges is that there is an increased need. We have an increased need, and the severity of need that people have has been very obvious in terms of the request for services, the amount of services that are needed to support this community. And so again, it takes us advocating together. We are not trying to not pay our providers. We definitely want to continue, and we are going to continue to pay our providers and work with our providers. But we also need to take advantage of any opportunities we can for additional grant funding, for advocating for DCW wages again and again and again until we really have an impactful response from legislators. And I think a lot of times they don't really know what some of the challenges are until things such as this Rochester Hills tragedy occurs. They don't really understand the level of need that people have even prior to the pandemic, prior to the tragedy in Oxford, and prior to the tragedy in Rochester Hills. We really need to make the community understand the need for mental health services, that the workforce needs to be supported and our providers need to support so they can continue to do the good work that they're doing. And amazingly, despite some of our challenges, our providers are doing amazing things, and they still step up when we have the extra needs, such as support in Rochester Hills. So I just really want to make that apparent that this is an ongoing attempt and ongoing commitment to work with our provider community, to work with our stakeholders, and really advocate at the state level for appropriate funding of a system that's underfunded and historically has been underfunded. And even more now because we pushed all of our dollars out during the pandemic to make sure that our providers have stability. And it bothers us tremendously as a team to have to say no to some of those requests now because we just don't have the additional dollars to provide provider stability payments as we did a few years ago. So with that, I'll stop. And there are a lot of things in my report, but I really want to focus my attention on those really critical pieces and really talk about the importance of us collaborating and advocating for those additional funds to support our system. Thank you.
Thank you very much, and thanks to Trish also for the update. Any questions for our director? There being none, we'll move on to board member comments, and Adam, I'll start with you.
I'd just like to thank all staff involved, and not only here in the building, but at the county level that did respond to the shooting tragedy over the weekend. Unfortunately, we do have to do this again, but it's gratifying that we have resources and people in place that are able to help in this dire situation. So I'd just like to thank everyone who stepped up over the weekend. Have a good evening.
Yes, go ahead. Dr. Giles.
Not to repeat what's been said, but I do want to say thank you for the response, given the tragedy. It's unfortunate that we have to continue to learn from past experiences, which means that it continues to happen. But I think because of what we've experienced, we're now better, and many of the opportunities we can now provide to those affected, unfortunately, have come from what we learned in Oxford. I'd also like to thank, I'm going to mess up her last name, I think she's left, Kate Spiney, for her very informative presentation, but also for the services that she provides. Thank you.
I also want to show gratitude for how we've responded to the incident this weekend. And Tricia, congratulations on your new position. I wanted to say that I had lunch with a county commissioner this week, and they mentioned you by name, saying how amazing you are. And it really does show through everything that you do. And to your staff members as well, and the other OCHN staff members that have responded, thank you so much. Wish we didn't have to go through this, and it's sad that we're getting good at responding to these tragedies, but we have to be prepared. Thank you.
To ditto some of the comments that have been made by previous board members, do thank you for the prompt response and also the presentation on today. I know that there is still a lot of work to be done, and it is gratifying to know that there are committed people to do that work. Thank you.
I agree with the comments that have already been made, and I do want to add my voice to the rest of the board for gratitude for what's been done over this past weekend. It really breaks your heart to have to hear about things like this, and I just wish that there was some way we could eliminate gun violence, and I don't know what that's going to take, but no parent should have to bury a child. No child should have to bury a parent because of someone else's actions. So I'm hoping the day will come when we'll be able to treat this as serious as it is and take action. Thank you.
Sarah May?
I echo all of the other board members' comments. Also, congratulations, Tricia. Did they cry when you moved positions? Did the sheriffs cry? I would have. Also, I was at the conference last week, and I just wanted to pass along to the staff that anybody who read my name tag would stop me and tell me how amazing it is to work with OCHN. Oh, I've reached out to them for this, or I've, worked with them on that, and they have nothing but glowing reviews for the staff. And basically, your staff is the gold standard, and how do you do all of this? And everywhere I went, if they read OCHN, they were really excited. Now, and I just had to be like, I'm just a board member. But I did tell them I'd pass it along, so.
Thank you. Mr. Jones?
Well, let me first echo the same words, similar words, to congratulate Trish on just a job well done, and congratulations on the promotion. It's well deserved, and you know, sometimes you just can see somebody who knows what to do and fits the position, and that's where you are. So I want to say congratulations to you on the start of a great job and the great expectations that you're going to bring to this group. So thank you so very, very much. In relation to the incident on this weekend, and certainly all of our hearts are, really concerned about it and heavy because of what happened, and especially when it deals with children. When it deals with children. Over the year, we've been able, with Christina and with Suzanne and with Kathleen, to look at what we call solidarity and what happened there at Oxford. And what's good today is to know that the experiences that occurred, the situations that we have been able to address, really sort of prepared us somewhat for this. You're never really fully prepared, but at least the things that were put in place, the responders, the co-responders, and all of that. So I'm excited about that and view that that's going to be a great benefit, not just to OCHN, but all of the entities that we work with and serve. So I compliment those 25 people. Thank you, Adam, who put in that extra time to go and talk to people and to address this situation, to stay with it, whether it's in Oxford or, whether it's in Southfield or what have you. But we thank you so very, very much for what you've done. I also thank the presentation today, and it just lets us know there's an area everywhere that we need to look at and need to address. A lot of times we talk, everybody has something going on. Everyone has something going on. And what is most important is how we address, or how do we approach those things. So thanks to this staff. I've said it before, we have a great staff, a great group of people. Thank you very much for what you do. Thanks for the extra effort. And thanks for what you have brought to us today. Thank you, Mr. Chairman.
Thank you. Trish, congratulations. As I said earlier, I think OCHN shown well. The community appreciates it. So Trish, here's my challenge to you since you've got all the accolades. We saw it from a university standpoint. We've seen Rochester Hills, which was in our backyard, Michigan State, which affected us too, Oxford, which we had siblings on campus. So the common piece that is always talked about is, in the media, it's like the 2 weeks prior to it. But the reality is it's the 2 years or the 10 years or all the things that didn't happen. And so as I heard you say you're going to stay in the community, which I think is good, but I think where we've got to connect is, something was missed. For somebody to walk into a setting like that and kill people and then kill themselves. Same thing Oxford, same thing in a number of places. So as we walk away from this, I heard about the learnings. Security-wise in the university campus, we're like a fortress, right? As soon as this kicked in, everybody is ready. The question is now, how do you make sure that the person who's sitting alone somewhere, that we can reach them? And that's challenging. It's what we hear. But that level of anxiety that's built over the pandemic years, we need to kind of figure that out as well. So congratulations to Adam. Let's figure out a way so we don't have to learn from the next one. Thanks.
Thank you for all those comments. We'll now move on. Our last item is to go into closed session, and for the public who may be watching or here, we will have no items of business after this matter. We are going to assemble the board in another room, the Huron room, which is on this, Superior, I'm sorry, which is on this floor. And after that meeting is done, we're going to open the door. We have to move it back into closed session under law, and then we're going to adjourn the meeting. So there's no more business being conducted other than the closed session. So at this time, I need to seek a motion to go into closed session pursuant to Michigan compiled laws 15.2681H to consider written attorney-client privilege opinions and recommendations dated June 5th, 2024, that are exempt from public discussion or disclosure by state or federal statute. There's also some accompanying documents that we will be reviewing with that opinion. So that's the motion, and it has to be very particular, so that's why I read it.
So moved.
So moved. It's moved and supported. We need a roll call vote, please. Oh, I'm sorry, is there any discussion on the motion? There being none, we'll need a roll call vote.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Ms. Root? Ms. Woodruff?
Yes.
Ms. Newman?
Yes.
Mr. Young?
Yes.
Pastor Jones?
Yes.
Ms. May? Yes. Mr. Cowan?
Yes.
Motion carries.
Okay, so we'll adjourn this portion of the meeting and hopefully be able to recommence in the Superior Room in the next 5 minutes. Thank you.